Good day everyone. Today we're dedicating to a topic that affects millions of people worldwide, osteoarthritis. We'll focus entirely on what osteoarthritis is, what happens in the body, how it develops, and how it impacts everyday life. I'll also share stories of real individuals to help illustrate what it's like to live with this condition. Let's dive right in. What is osteoarthritis? Osteoarthritis is the most common form of arthritis. It's often described as a wear and tear condition because it primarily occurs when the protective cartilage in your joints gradually breaks down over time. To understand it better, let's first look at how a healthy joint works. Imagine two bones meeting in a joint like the knee or the hip. At the ends of these bones is a smooth, rubbery tissue called cartilage. This cartilage acts like a cushion, allowing the bones to glide over each other without friction. It also absorbs the impact from movements like walking, running, or even climbing stairs. Now, in someone with osteoarthritis, that cartilage begins to wear away. Without that cushion, the bones start to rub directly against each other. This causes pain, stiffness, swelling, and often a grinding or crunching sensation known as crepitus. Over time, the joint can become inflamed, less flexible, and even deformed. Let me share a story about Sarah, a 52-year-old teacher. Sarah started feeling a dull ache in her knees after a long day of standing in the classroom. At first, she brushed it off, thinking it was just normal fatigue. But over the years, the pain worsened, especially when climbing stairs. She also noticed a grinding sound every time she bent her knees. After seeing a doctor, she was diagnosed with osteoarthritis. What surprised her most was learning that this condition didn't happen overnight. It had been developing slowly for years. The slow development of osteoarthritis. Osteoarthritis is a progressive condition, meaning it doesn't appear suddenly. It develops over time, often starting with mild symptoms that people might ignore. For instance, you might feel stiffness in the morning that goes away after moving around, or a joint might ache after strenuous activity but feel fine the next day. Here's an example. Mike, a retired construction worker, spent decades lifting heavy materials and working on his feet. He loved his job but didn't realize the impact it had on his knees. By the time he was in his late 40s, he started noticing pain after long days on the job. Initially, it was occasional, but as the years went on, the pain became constant. By the time he retired, he found it difficult to walk short distances without discomfort. What Mike experienced is typical for osteoarthritis. The condition often starts as occasional pain or stiffness but gradually worsens as the cartilage continues to wear away. How osteoarthritis affects the joint. To truly understand osteoarthritis, it helps to know what's happening inside the joint. In a healthy joint, several components work together. Cartilage cushions the bones and allows smooth movement. Synovial fluid, a thick liquid that lubricates the joint and provides nutrients to the cartilage. Bones, the hard structures that form the joint. Ligaments and tendons, tissues that hold the joint together and support movement. In osteoarthritis, the cartilage thins and deteriorates, leading to bone-on-bone contact. Without the cushion of cartilage, the bones rub against each other, causing pain and stiffness. Inflammation, the joint can become inflamed, leading to swelling. Bony growths, the body tries to repair the damage by forming small bone spurs, which can make the joint feel stiff and limit movement. This was the case for Emma, an avid gardener in her 60s. Emma loved spending hours planting flowers and tending to her vegetables. But over time, she noticed that her fingers started to swell and her grip weakened. Simple tasks like holding a watering can or pruning plants became painful. Her doctor explained that the swelling and stiffness were due to osteoarthritis in her hands. The symptoms of osteoarthritis. The symptoms of osteoarthritis can vary from person to person, but common signs include pain. This is often the first symptom people notice. It may be mild at first, appearing after physical activity and improving with rest. Stiffness, especially in the morning or after sitting for long periods. Swelling. The joint may appear swollen due to inflammation. Reduced range of motion. The joint may feel less flexible or stuck. Grinding or popping sounds. This occurs when the rough surfaces of the bones rub against each other. Let's talk about James, a grandfather who loved playing catch with his grandchildren. Over the years, he noticed that his shoulder didn't move as freely as it once did. It felt stiff, and he started hearing a popping sound whenever he tried to lift his arm. Eventually, the pain became so severe that he had to stop playing catch altogether. Who is at risk for osteoarthritis? While anyone can develop osteoarthritis, certain factors increase the risk, such as aging, previous joint injuries, or repetitive stress on a joint. However, I want to emphasize that osteoarthritis is not just a result of wear and tear. It's a complex condition influenced by various factors. For example, Alex, a former athlete, was diagnosed with osteoarthritis in her early 40s. Years of running and playing sports had put significant stress on her knees. She often told people she wished she had been more mindful of her joint health when she was younger. Living with osteoarthritis. Living with osteoarthritis can be challenging, but it's important to remember that it's a manageable condition. Many people adapt their lifestyles to minimize discomfort and maintain their quality of life. I once met Robert, a chef who developed osteoarthritis in his hips. Standing for long hours in the kitchen became increasingly painful. He started using a stool to sit while prepping ingredients and adjusted his work schedule to include more breaks. These changes allowed him to continue doing what he loved without putting too much strain on his joints. Osteoarthritis is a condition that develops gradually and can significantly impact daily life. It begins with the breakdown of cartilage and progresses to affect the entire joint. While it's often associated with aging, it's not an inevitable part of getting older. It's a complex condition influenced by lifestyle, genetics, and joint health. Thank you for joining me today as we explored what osteoarthritis is. I hope the stories and information shared here have given you a clear understanding of this condition. Remember, knowledge is the first step toward managing and supporting those affected by osteoarthritis. Subscribe, comment, and share. See you next.